Ladies, have you ever looked down during your period and thought, wait, why is my blood black today? Or maybe brown, or even pink? Before you freak out, breathe. You are not alone. Hi, I'm Dr. Azmi, and in today's video, we're talking about something most women notice but rarely understand: the different colors of your period blood. What they actually mean, what's normal, and what's not. So, grab a cup of tea, hit that subscribe button if you haven't already, and let's decode what your period color says about your health. Black period blood. Okay, let's start with the one that freaks out most women. Black period blood. You go to change your pad or tampon, and there it is. A thick, dark, jelly-like blob. Looks scary, right? But here's the thing. It's usually just old blood that's taken its time to leave your body. As it sits in the uterus or vagina, it mixes with oxygen and turns darker. That's all. You might see this towards the end of your period, or if your flow is slow. Now, let's bust a myth. Black period blood does not mean there's a blockage inside your vagina. The only time you should be concerned is if the discharge smells foul, or if you feel unusually tired or dizzy. That's when you should see your doctor. Next up, brown period blood. This one's pretty common. And again, it's just blood that's been oxidized. You'll usually notice this at the start or end of your period, or sometimes in the morning, after lying down for hours. That's because the blood has had time to sit in your vagina and mix with oxygen. You might also notice brown spotting after coitus, but that doesn't mean it's old blood from last month. That's a total myth. Your uterus doesn't store blood. It cleans itself out regularly. Now let's talk about the most familiar. Red blood. You'll usually see this in the middle of your period when the flow is steady and healthy. Bright red blood means it's fresh and flowing quickly. Totally normal. But here's a crucial reminder. Not all red bleeding means it's your period. Red bleeding could also come from things like a cervical polyp, an infection, or in rare cases, an ectopic pregnancy. So if you ever notice bleeding outside your usual cycle, please don't self-diagnose. Always get it checked with your doctor. Now, what about pink period blood? You might see it at the beginning of your period, or when your flow is really light. That's because your blood is being diluted by vaginal discharge or cervical fluid. Myth alert. People say pink blood means you have low estrogen. That's not true. In fact, pink period blood can happen when estrogen is low, high, or completely normal. It's mostly about how diluted the blood is, not your hormone levels. Okay, now let's clear something up about gray or watery-looking period blood. You should never have gray period blood. If you do, it might be a sign of bacterial vaginosis, and you need to see a doctor right away. And if your blood just looks a bit watery, don't panic. That usually means it's mixed with discharge, not that you're anemic. So here's the truth. The color of your period blood doesn't define your health. It's really about three simple things. First, how fast the blood flows. Second, how much oxygen it's exposed to. And third, whether it's mixed with discharge. If your blood flows fast, it looks bright red. If it moves slower, it turns dark red or brown. And if it's diluted, it can look pink. Simple, right? So ladies, next time your period changes color, don't panic. Most of the time, it's completely normal. But if your periods are painful, heavy, irregular, or you notice bleeding after coitus, between periods, or during pregnancy, please see your doctor. If you found this helpful, give this video a thumbs up, share it with your friends, and don't forget to subscribe for more real, honest health talk with me, your friendly doc. Because remember, periods are not disgusting. They're powerful, natural, and completely normal. Thank you for watching. Until next time, stay healthy, stay happy.
Check out some more awesome videos.